meet my patient at the beginning. I discuss with them the importance of having colonoscopy, go over the details of the procedure itself, and emphasize that it's something that has to be done above a certain age. During the endoscopy itself, we take a very good look at mostly every single part of the colon. And when we identify the colon cancer, we take biopsies. We mark the site for the surgeon so that he knows what part of the colon to resect. And then after the procedure, of course, I review the details with the patient, and we review the details, all of us, several specialists together, and come up with the treatment plan. A year later, we have to repeat the colonoscopy to make sure that the colon cancer does not return again. And that continues with the protocol a few years down the line as well. So even though the patient may feel that they have had the colon cancer taken care of, it's actually really the beginning of a long-term follow-up. As you know, even in the absence of colon cancer, colonoscopy has to be repeated serially every few years as well. Colon cancer, unfortunately, is one of those silent tumors that grows without any symptoms at all. Of course, the most important thing we're looking for is polyps. Polyps can be very tiny and small, and they can be moderate in size or large. And they can be raised or they can be flat as well. That's our main concern. And we are aiming to remove them all. And for those that are beyond the ability of the endoscopy to remove them, which is either because of the location or the size of it, we mark them, and we send them for surgery to take them out, even though it's just a polyp. But it's significant for us because we can never tell what's inside the polyp unless we take it out and look at it under the microscope. If the tumor left the wall of the colon and involved regional areas like lymph nodes close to the colon, in this case, we'll probably not just resect, but also treat with chemotherapy or radiation therapy afterwards. And I think our team with the tumor board manages colon cancer just as well as any center in Houston or any other place of the country. I do love what I do, and I enjoy it very much actually, and I like the fact that we are helping a lot of our patients get better, whether related to colon cancer early detection or taking care of other GI-related causes. We are preventing a lot of colon cancers by doing colonoscopies and removing the polyps before they have a chance to develop into colon cancer. And also feeling better about the fact that we're detecting many times colon cancer very early on, even before the patient has any chance of developing any symptoms.